Hello everyone, this video is about OET Reading Part C. Now, we are going to tackle OET Reading Part C, the section that can feel like a mountain of patient files, notes, and reports. But don't worry, by the end of this session, you will know exactly how to approach every text like a clinical detective. Here's what's different about this video. We are not just reading theory. I'm going to give you full real exam style examples, show you how to reason out every answer and explain why each distractor is wrong, all in plain and very easy way. Okay? So think of it as your exam preparation lab, live and interactive. Ready? Let's get started. The first one is understanding the beast, decoding part C. It's more than just reading. First things first. So, what exactly is part C? It is usually the longest, most complex section of the OET reading test. You will face either multiple short texts like patient referral letters, discharge summaries, or information sheets, or one long clinical scenario where a detailed patient file history, investigations, and treatment plan. But here is the challenge: the questions don't just ask for a fact, they test your ability to spot the relevant information in a sea of words. So you have to understand clinical language and context and try to ignore irrelevant details and distractors. Reason like a healthcare professional. That's how you have to choose your answers, supported by the text. And remember, you never assume anything not in the text. Your answers must be evidence based, just like in real life patient care. Okay, now I'm going to give you the power strategies, your OET reading toolkit. Think like a clinician. The first one is skim smart, scan smarter. You have to find the needle in the patient history haystack. Before reading questions, skim the text once. I mean, literally glance through headings, bolded words, list, and key dates. Don't read every word. Just get the structure. What's the history? What's investigation? And what's the treatment? Then, when a question asks about, say, for example, treatment recommendations, you already know exactly where to look, right? So, this saves massive time. And the second one is spot the clinical cues, which means the vital signs, investigations, and hidden hints. When you read in detail for questions, you have to pay attention to the numbers such as ages, doses, oxygen saturation, blood pressure, all these numbers. And also for medical terms, the terminologies such as asthma, COPD, antibiotics, PRN related to the medical terminologies, right? And actions or verbs like administered, what does it mean? Recommended, the meaning of it, observed. So you should know all these terms and details. Then only you will be able to answer it properly. So these are often paraphrased questions. So spotting them helps you quickly locate the right answer. Okay? You have to spot the clinical clues. The next one is question whispering. Try to turn every question into your own words. Before checking the options, try to paraphrase the question in your mind. For example, if the question says, which of the following is true regarding Mr. Smith's current treatment? It's just an example. So you have to mentally rephrase it. Okay, you have to look at the treatment section. Ignore history, ignore social information, and you have to focus on medications and plan because the question is which of the following is true regarding Mr. Smith's current treatment. So, current treatment, no need to look for the history, no need to look for the social information. You have to concentrate on the current medications and plan. Okay, so this step prevents you from being tricked by distractors and saves mental energy when you compare the options. The fourth one is eliminate the noise. Most questions have 2 to 3 strong distractors, so don't panic. You have to start by crossing out obviously wrong options, matching your paraphrased answer with the text. Only then pick the one that fits perfectly. So don't second guess unnecessarily. Your first carefully reasoned instinct is often correct. go with that. Then we will look at example here. Mr. John Smith, 55 years old, presenting complaint as persistent cough for 3 weeks, past medical history, mild asthma, no hospital admissions in last 5 years, current medications, salbutamol inhaler PRN, social history, non-smoker, works in construction, examination, mild wheezing, oxygen saturation 96%, investigations are chest x-ray normal, spirometry shows mild obstruction, and plan is continue inhaler, consider follow-up in 4 weeks or sooner if symptoms worsen. And here is the question. Which best describes Mr. Smith's current condition? Options here are acute asthma attack, chronic asthma under control, severe COPD exacerbation, and pneumonia. So these are the options for the first one. And we will just go through the questions first and I'll come to the answers next. Which statement about his social history is correct? The second question. And the options are he's a smoker, he works in a hospital, he works in construction, he has frequent hospital admissions. And we do have a third question. The third question here is regarding treatment, which is true. Hospital admission immediately, continue salbutamol inhaler PRN, start antibiotics immediately, stop all medications. Now, for the first question, right, which best describes Mr. Smith's current condition? Look at the persistent cough, 3 weeks, mild asthma, oxygen saturation normal, chest x-ray normal, acute attack no, COPD no mentioned, pneumonia no, x-ray normal, right? So option B is the correct answer. Okay. And for the second one, question 2, social history, non-smoker, works in construction, right? So option C is the correct answer, okay? And for the third question regarding treatment, which is true, continuous salbutamol inhaler PRN. Because in the treatment plan, it is clearly given follow-up for 4 weeks. So answer B is the correct option. So always try to find out the correct answers based on the exact text, never assumptions, okay? Now I'm going to tell you some of the pitfalls that you need to be really aware of. The first one is the assumption trap. Don't infer information not in the text. Remember that? That's very, very important. And the paraphrase puzzle. You have questions often reword the text. So always you have to match the meaning, not exact words. The rush hour error, this is also most of the candidates will do because skimming too fast can make you miss numbers, doses, or dates. And watch out for the distractor. Minor details are designed to trick you. So you have to compare options in a careful way. So here are some of the final clinical boosts for you. Practice 1 or 2 long patient files daily and always paraphrase the questions aloud because that trains your brain for reasoning. And make a clue list, investigation keywords, treatment keywords, symptoms, all these things. And after practice, you have to ask yourself, why did I pick this option? Why not the others? So this makes you to force the reasoning trick. Okay. All right, healthcare warriors, that's your ultimate Part C roadmap. Skim smart, scan for clues, paraphrase questions, and eliminate distractors. Always reason like a clinician. That's all for today's video. Kindly like, share, and subscribe for more OET tips. See you in the next video. Bye-bye.